have looked at the organization, formation, and structure of the World Health Organization, which is the apex body for international public health and is a specialized agency of the United Nations for the same. In this lesson, let us look at the various functions which are exercised by the World Health Organization. Now, the World Health Organization primarily functions by strengthening the health infrastructure of member states. Now, why is that? This is because primarily health services are provided by the government of various countries to their people. Therefore, WHO wishes to improve on this existing infrastructure and not to replace it altogether. Now, in the contemporary world we live in, health infrastructure of one kind or the other already exists, which means that doctors, healthcare providers, emergency respondents, hospitals, nursing homes, medicine supply chains, and such other things which make up a health infrastructure already exist. And these already exist in the member countries of the WHO itself. However, this infrastructure has some issues. It faces lack of resources, lack of proper knowledge, and also lack of direction. WHO strengthens the health infrastructure of these member countries by being that sense of direction. So as we can understand, WHO realizes that replacing an existing infrastructure is redundant and instead acts as the coordinating body, which then overhauls the existing infrastructure in the following ways. It is done by improving existing facilities for health, including health centers such as hospitals. It also includes the training of manpower or creating an effective healthcare workforce, one which performs its services reliably in a fair manner and also is very responsive. Moving on, WHO also focuses on improving information systems, which pushes for universal awareness of health issues and also public knowledge about various diseases and how to prevent them. Now, WHO also wishes to be the platform where leadership and financing services could be overhauled. Now, leadership is management administration behind these health services, which makes sure that these services are properly provided. And financing is required for any health service. As for people to access these services, often they are at a risk of going into financial catastrophe. And therefore, there needs to be a proper health financing model which can assure people of good health services without breaking the bank. Apart from this, WHO also improves whatever facilities relating to any other health related services for society there currently exist. In these pictures we can see this particular overhaul of the infrastructure being carried out by WHO professionals, where over here we can see child care health professionals are attending a seminar which is convened by a WHO professional, and over here we can see such similar leadership models being carried out by WHO. Now, WHO strengthens the health infrastructure of the member states by collaborating or assisting the governments of these member states to finally provide for a well-functioning health system which ensures equitable access to essential medical products, vaccines, and technologies which would be safe, cost effective, and of a certain quality. That is the primary function of the World Health Organization. Now, WHO also functions to improve the nutrition and also provide medical care of the mother and child. Now, talking about nutrition, WHO does not only deal with nutrition of children and in fact aims to bring about improvements in nutrition of children and adults at the same time by setting standards that are followed by other agencies. Now, what exactly is nutrition? Now, nutrition is the basic amount of food required by our body, which is either provided to us or taken in by us, which is essential for human growth and survival. Now, nutrition is essential for health and well-being at every stage of life, as this WHO poster itself says. We can see an effective nutrition is essential while you are being born, while you are a young child, when you are a teenager, when you become an adult, and also in your old age. And WHO makes sure that this essential nutrition is provided to you by setting the standards for all other agencies, government agencies as well, to follow. Now, speaking of the medical care of mother and child, we have a contradiction. We already have seen that it is UNICEF which primarily looks at this particular field of work. And that is why WHO in fact partners with UNICEF and works to provide proper mother and child care, taking care of both physical and mental health. This particular collaboration, in fact, is a very ideal one. This is because WHO understands the subject, which is the medical care, while UNICEF understands the one who is getting this particular medical care, which is the mother and child. WHO, in fact, has its very own Child Health and Development Unit, and this primarily works to arrange investments, to facilitate research, and to also create various strategies that are required to improve the provision of health services to children. We can see some awareness posters which are issued by the Child Health and Development Unit. On the right side, we see a poster which is urging member states and their governments and even private bodies to invest into child health services. And over here it says that investments in early childhood development help children, families and societies to thrive. Now this investment should be in the policies that support families, such as paid maternity leave where a mother can stay back at home and take care of her newly born children instead of worrying about her income coming in at a point of time. Then child benefits which are provided to every single child at the time of their birth by the government itself. And finally, affordable and quality childcare, which WHO thinks every government should be heavily investing in. And over here we see an awareness poster by the Child Health and Development Unit, which is focusing on a psychological research, which says that holding and playing, frequent eye contact, talking and singing helps a baby learn, be happy and thrive. So you can understand that the Child Health and Development Unit has a very unique take when it comes to provision of health services to children. Their own slogan is every child should have responsive care. In fact, the very vision of the Child Health and Development Unit is to redesign the entire child health agenda, which acknowledges that every child is unique and therefore their health care requirements are also different. WHO also realizes that the provision of wash facilities, which are water, sanitation and hygiene facilities, are very important in maintaining public health itself, and therefore WHO aims to provide strategies and frameworks along with leadership and funding for the provision of clean and potable water, which is drinkable water, and better sanitation facilities to underdeveloped countries. So what is it? So again, remember, the wash facilities or water, sanitation and hygiene facilities is what WHO feels is required for every country, especially the underdeveloped countries, and WHO aims to provide such facilities by strategies, frameworks, funding and even leadership. Over here you can see a young child in a remote African village is getting access to clean drinking water thanks to WHO. And in this picture you can see sanitation work is being carried out by WHO sanitation workers. WHO also promotes better hygiene practices, as cleanliness is a mentality and therefore it has to be inculcated, and simply providing wash facilities or water, sanitation and hygiene facilities is not enough as long as people do not know how to maintain the same hygiene. Thus, WHO promotes such better hygiene practices and even teaches proper disposal of waste, and this is done primarily through awareness mechanisms, and of which we can see some instances here through some posters. On the left we see a poster by WHO which urges everyone to wash their hands, and as you can understand with the theme of the poster, it is particularly targeted towards young children. It gives step-by-step process of how to wash one's hands effectively. On the right we see proper waste disposal being shown through an awareness poster. As you can see, a proper segregation or separation of waste is being shown here. Cans, which are metals, are being disposed over here. Plastic bottles are being disposed in this bin and glass bottles are being disposed in this bin. Now, do you know what this particular symbol is? This represents the three principles of waste management: reduce, reuse, and recycle. Now, WHO understands the amount of public awareness and attention it can bring if it happens to endorse a particular event or issue. That is why WHO observed the period between 1980 to 1990 as the International Drinking Water Supply and Sanitation Decade, which happened to bring out into international focus the various issues being faced by the supply of water and also the extension of sanitation facilities all throughout the world, and the consensus which it gave birth to led to a prioritized strategizing to solve these issues by all member countries. Over here we see the emblem of the International Drinking Water Supply and Sanitation Decade, which was observed between 1980 to 1990, which was a decade between 1980 to 1990, which were the years 1981 to 1990. Now, can you answer this question? Which decade was observed as the International Drinking Water Supply and Sanitation Decade? Was it the decade between 1990 to 2000? Was it the one between 1980 to 1990? Was it the one between 1970 to 1980? Or was it the one between 1950 to 1960? The correct answer is the decade between 1980 to 1990. WHO also acts as a standardization body. Now, what is a standardization body or agency? It is one which sets the basic standards in a particular field in which everyone else has to abide by. Now, medicines need to be of a certain purity and medical equipments need to be of a certain effectiveness to properly work. And to make sure this happens, WHO sets a standard for these medicines and medical equipments. This also helps the fact that most of these medical equipments and medicines are manufactured by private entities, and therefore it acts as a check on what they're putting out in the market. These universal standards are also very important in the case of certain life-saving drugs, in which case even a percentage of purity indifference can cost someone's life. Now, since WHO is the specialized agency of the United Nations to ensure public health of the world, it therefore aims to eradicate such killer diseases. Now, these diseases primarily afflict infants and young children since their immune systems are weaker and they are thus more susceptible to such diseases. Now, WHO aims to eradicate killer diseases such as polio, malaria, etc. by leading programs to eradicate them. In this picture, you can see an instance of Guinea worm disease eradication program being carried out by World Health Organization health professionals. Now, Guinea worm is a parasite which enters the body in larva form and then it roots into the body, which causes swelling and weakness. Removing a guinea worm from the body is a very delicate process, and this you can see in this particular picture where the World Health Organization workers are effectively removing the guinea worm from this person who's affected by it. Now, on the right you see World Health Organization officials launching the 1980 issue of the World Health Organization magazine, which declared that smallpox is dead, which signified that World Health Organization has effectively managed to eradicate smallpox. Now, we saw this particular issue of the magazine when we were discussing the achievements of World Health Organization. But do you remember how WHO was able to eradicate smallpox? You see, smallpox, like most other diseases, can be eradicated or prevented through effective immunization. Now, immunization is the procedure of increasing the immunity of the human body, especially those of children, using various means such as vaccination, which in turn can help prevent the spread of diseases in these human bodies. And WHO wishes to eradicate such deadly diseases through immunization, effective immunization, particularly for children. Now, WHO already provides effective immunization programs for children against 6 major communicable or easily spreadable diseases, which are polio, measles, tetanus, diphtheria, tuberculosis, and whooping cough. In these pictures, you can see some instances of immunization being carried out. But most diseases do not affect humanity in a slow manner. In fact, deadly diseases particularly break out as epidemics and in some cases even as pandemics, which spread all across the world. In this particular scenario, there needs to be an emergency response mechanism to deal with the spread of these diseases. In fact, if you remember, WHO itself was incepted to quickly deal with such epidemic level diseases. Now, WHO does that by setting up special crises committees of the World Health Assembly, along with also understanding how to prevent the spread of these diseases, and finally discuss and come out with the eventual immunization against such epidemic causing diseases. Now, in the year 2020, the coronavirus pandemic broke out across the world. The rapid spread of this particular virus alarmed all nations around the world, and they turned to the World Health Organization. WHO immediately set up a COVID-19 task force, a picture of which you can see on the right over here, which was given the task of analyzing exactly what this particular virus is and to also understand how to prevent the rapid spread of this virus, and finally also give effective steps to come out with the immunization program for it. WHO has a very important function of facilitating research, training and the spread of information. You see, medical science is a very dynamic discipline, and it also happens to be a volatile one. This is because every single day some new threat to human health surfaces. Therefore, medical science has to always be ahead of such threats and even update itself from time to time. This can only be done through research. And that is why WHO promotes such research, particularly the ones which lead to development of new technologies in the area of medical care to cure previously uncurable diseases and to also prevent the spread of existing diseases. Now, the field of public health is nothing without the healthcare providers. They make up the workforce of the entire health infrastructure. But just like research is required to improve the scope of medical science, similarly training of this workforce is required to make sure that they are able to properly deliver these services effectively. That is why WHO arranges conferences and seminars to train this healthcare personnel from different countries in the techniques of preventing diseases and also carrying out their health services. Over here you can see an instance of such a seminar being carried out. But WHO also realizes that this particular information is not only for professionals. This is because even a single second can save a person's life, and a person who is not a professional can also save a person's life only if he or she knows what they are doing. To make sure this happens, WHO wishes to give everyone access to understanding how to carry out basic health services and also first aid. And in that effect, WHO has launched its own website, openwho.org, through which one can access essential knowledge for managing public health emergencies. And this particular forum is open to all, anytime, from anywhere. WHO also realizes that having a proper information system is essential for having an effective public health environment. That is why WHO wishes to spread awareness and to enhance public knowledge on the various developments that is taking place in medical science. WHO educates and informs people about the latest developments in healthcare and sanitation, and this it does by publishing journals, the most prominent one of them being the Bulletin of the World Health Organization. WHO also has a medical library in its headquarters at Geneva, a picture of which you can see over here, and this is the world's largest reserve of medical research. So in this lesson, we saw the various functions that are carried out by the World Health Organization, the apex body and the specialized agency of the United Nations to look after international public health. In the subsequent lesson, we will be looking at the various other specialized agencies of the United Nations and also see their functions. Don't forget to subscribe to our channel and hit the bell icon. You can also register for free at deltastep.com or download the DeltaStep app to learn one-to-one with our amazing teachers or to get access to all our 5000 plus amazing videos as per your school syllabus. Master each topic with our adaptive practice technology. Get million plus questions with step-by-step solutions and unlimited mock tests. Get all your doubts resolved instantly. Learn via games and win amazing prizes like PlayStations and iPads. So at DeltaStep, learning is not just fun and easy, it is rewarding too. So register for free now.